Greenman corrects that one first. But then, when you're talking about this, we could call it two joints, even though it's, suffice to say, it's one. So we've got the ilium on the sacrum. So this is the ilio-on-the-sacral joint. But then you'd say to me, well, isn't it the sacro on the ilium, which is the sacroiliac joint? And it's a yes and it's a no. Okay, because basically, when people say, oh, my pelvis is anterior, what they might mean is that the innominate is anterior in respect to the sacrum. So it's the ilium on the sacrum that's anteriorly rotated. So it's an iliosacral anterior rotation, rather than a sacroiliac anterior rotation. Okay, because it's not the sacrum's fault, it's the ilium on the sacrum that's going forward. Okay, and vice versa, if this has gone back, it's a posterior rotation of the innominate in respect to the sacrum. This can also go out, they call it out flare. It can also go in, they call it an in flare. So basically this can turn in, not quite, it's hard to show you on this, but it'll flare in or flare out. What's quite common is that this can go up and down, more so up rather than down. If it goes up, it's called an iliosacral up slip. So if you have trauma and you land on your side, then this can go knocked upwards. And then you might find you get pain in the QL, because the QL will be overly tight on that side. The facet joints might give you some pain because this is all compressed in here. So we'll do a correction for that. The most common dysfunction is that the innominate goes forward. There's a book by Schamberger, Wolf Schamberger, 624 pages, and he basically only talks about the anterior rotation innominate in all of it. Okay, that's what he talks about. It doesn't talk about anything to do with the sacrum. It's all about this going forward with a compensatory, this one coming backwards. So if this has gone forward, he says the anterior side is locked. So if it's anterior, what will happen to the leg length? Shorten the length? Longer, good. Okay, so you have a functional wrong leg on that side. What position is the hip in? Flexion or extension? Flexion. Okay, so the hip is flexed. This is
like
anterior.
hip hitched. Is that what we class as hip hitched now?
No. So it's anterior, so we have to say what it is. So these like words that people use, the hip shift or hip hitch in, things like that. It's hard to say exactly what that is, because we say that's a hitching of the hip. But then it's not the hip, it's the innominate that's going up. Okay, but then Greenman does say it's an iliosacral, no, it's a hip bone shear, is a term he might use for that. So if it has gone anterior, the hip will be flexed on that side, but the lumbar will be lordotic. Okay, so if you've got movement of A, you affect B and C. And also, I mentioned earlier that the sacrum can rotate on its axis, like I showed you with that thing, wherever it is. So basically, it sounds quite complex. I'm not going to go through this. Lucy's on the course on the weekend, and so is so if the sacrum's gone forward, you can get stuck to the right. They basically use words like right on right, means it's rotated right on the right oblique axis, and you can also rotate left on the left axis. But it can also come back on itself, and it means it can rotate to the right on the left axis. It's called right on left, and just goes on from that. And then the sacrum can get fixed forward into nutation. It can also get fixed back into counter nutation. So we're just going to do some simple corrections, for the most common presentation. So that'll be pubic symphysis, anterior rotation with compensatory posterior, and an upslip. Okay, so we'll do them first. Lucy, let's use you. Okay, now for instance, just have a lie on your back. I'm not going to run through an assessment on this course.